Hello everyone. I want to update you on where we are with vaccines and try to provide some clarity for what is a confusing situation and raising concerns for some people. First, I want to be clear, the county does not have unused doses of vaccine lying around. Each week we administer 100% of the doses we received. I want to explain to you how Montgomery County receives its doses. I want to start by explaining that the entire state of Maryland only receives about 72,000 doses per week. Generally, we are told on the weekend how many doses we'll receive on the following Tuesday. This week, we were told on Monday how many doses we'd receive on Tuesday. I hope you can see how difficult it is to do advanced planning with such little notice. The state gives us no information on what to expect for the following week either. This week we received 11,900 doses in total. However, 4,600 of them are second doses for individuals who had already received their first doses. That means we received only 7,300 doses for new vaccinations. All of the doses will be administered this week. The second doses are a little more complicated, but they will be administered as fast as possible, mostly within the same week. As you can see, 7,300 is a small number of people getting vaccinated. As of today, based on the governor's announcements, more than 110,000 people in the county are eligible for vaccine, and beginning on Monday, more than 200,000 will be eligible. This is a supply and demand problem. The demand for vaccine far outweighs the supply that's available. While the governor has added about 200,000 people who are immediately eligible, vaccine supply has not changed at all. So if our allocation continues at current levels, we can only vaccinate about 7,000 new people each week. And considering that 7,000 people will also need to be receiving a second dose 4 weeks later. So what we're doing about this situation, we're trying to figure out how we move forward and can we get better coordination with the state. We all know we can't affect the manufacturing of the vaccines, so we're following the Federal Centers for Disease Control guidelines on how to prioritize who gets the vaccine first. As the CDC explains, these priorities were created in order to, 1, decrease death and serious disease as much as possible, 2, preserve function of society, and 3, reduce the extra burden COVID-19 is having on people already facing disparities. With that in mind, the CDC created phases 1A, 1B, and 1C, as well as phases 2 and 3. 1A includes the people at greatest risk to exposure to the virus because of the work they do or where they live. This includes emergency responders, law enforcement, health providers, and behavioral health staff. It also includes hospital staff, staff and residents at nursing homes, and we're finishing this group now. The doses for the hospitals and nursing homes are not sent to the county. They are done by others. We've also begun the pre-registration process for people in 1B, including seniors 75 and older, and expect this group to begin receiving doses next week. But just remember, we're likely to have 7,000 doses next week for 70,000 people who are eligible. You may have heard about some people being able to register and get appointments and others who registered and showed up for what they thought was an appointment, but was not, and I'd like to explain why. To register for a vaccine appointment, people must use the state system. It's important for tracking who receives the doses. That system was not designed with a filter. So if someone forwards you a link that was only intended for them, others can use that link, and that creates confusion and frustration. People sign up for spots that were not intended for them, and others are turned away from what they thought was their rightful appointment. That is why we have a pre-registration system. We will be contacting people and sending them the link to register and get the vaccine. You may be wondering, if you're pre-registered, when will you be contacted? I honestly wish I could tell you, but we don't know because we only find out each week how many doses we have, and there aren't nearly enough. We have asked the state to at least give us a 3 to 4 week forecast so we can do advanced planning, but so far that is not happening. And remember, every week we will have to use some of our doses that we receive for people who need the second dose. I hope this gives you some sense of the process. I know some people are frustrated and impatient, but I hope that I've conveyed that we're both getting our vaccines into people's arms as fast as we receive them, and we are doing it in a way that is efficient as possible for everyone involved. In the meantime, I want to remind people that our new case count is still very high, so please continue to follow the guidelines. Maintain physical distance, wash hands frequently, and please, please, please continue to mask up. And finally, I want to close by saying that yesterday, our new President and Vice President of the United States were inaugurated. I am hopeful that going forward, we will have better cooperation, coordination, and information from the federal government, which will help all of us get vaccinated sooner, so that we can all resume many more of the activities that we miss and that we need. Thank you.